Welcome to City and State TV. I'm Morgan Pechma. Today our guest is Joe Chacon. He's a senior advocate with the Osborne Association. Joe, thank you so much for joining us.
Thank you for having me.
You have a rally tomorrow at New York City Hall. Can you talk about what the rally entails and about the work of the Osborne Association?
Sure, no problem. The ATI Rally, ATI stands for Alternatives to Incarceration, is a coalition of 8 members, and we're all community-based organizations that provide services to people that are involved with the criminal justice system. I work with the Osborne Association as a court advocate, like you said. I work for a department called Court Advocacy Services. What that entails is services for people that have an open case here in the 5 boroughs. We provide mitigation services, and we advocate for alternatives to jail and lesser incarcerated sentences.
And so is your rally pushing for new legislation? Is it pushing for additional funding? What is the thrust?
It's not pushing for new legislation. Exactly, the thrust of the ATI Rally is to inform our congressmen and the mayor's office about funding for the coalition. Every year we go out and provide these services and save the city and state millions of dollars. In order to do that, we need to fund our services and our programs throughout the state.
And so what are the remedies, or when you're talking about alternatives to incarceration, what are some of those alternatives, and what have the programs been that you've seen the most success with?
Sure. I can speak for the Osborne Association. We provide several different alternatives. We have a substance abuse program called El Rio. We have a workforce development program. We have a fatherhood initiative that provides jail-based and community-based parenting classes. For court advocacy services, what we do and what I do is we assess clients in need of services, and then we determine what type of level and exactly where they need those services. So if it's substance abuse treatment, mental health, education like GED, or just reconnecting back to school, connecting them to the workforce, and reconnecting their families as well.
And I presume that you're talking about people who have been convicted of relatively small crimes. Is that correct?
Technically, CAS works with people that have not yet been convicted of a crime. Mostly, what we do, we come in on part of the defense team, and we provide services to defense counsel to advocate for an alternative plea deal that includes a community-based service organization.
Have we seen a decline in the number of arrests since the city has moved away from the stop and frisk policy? Because I recently read that there have been actually just as many, if not more, arrests for marijuana under the DeBlasio administration than there was under the previous administration.
I can't speak to arrest rates as they pertain to marijuana or even stop and frisk. What I can say is that ATIs directly address recidivist rates. So we seek to decrease the arrest rates for people that are being released from jail.
Increasing or eliminating the ability for the state to try juveniles as juveniles as adults. We're one of only 2 states where 16 and 17-year-olds can be tried as adults. Is that also a part of your advocacy work? Would that help improve your work at the Osborne Association?
Most definitely. We work with anyone charged with a crime in the city, but a lot of those people tend to be youth aged 15 through 19 who are eligible for youthful offender adjudication, which is essentially a non-felony conviction. So we do get to work with cases like that and with youth that are eligible for YO treatment, which includes a non-felony indicator on their record for life, which in essence, and which it does for a lot of adults in the system, is bar them from obtaining any status of living comparable to people that don't have a felony conviction, such as obtaining housing, applying for loans, going to college.
It seems that a lot of people's, misgivings about alternatives to incarceration is, what happens if somebody commits a crime and because they don't go to prison? I mean, is that something that do you monitor the results of the people whose services you have provided to?
Yeah, Osborne Court Advocacy Services and our other coalition members in the ATI Coalition all provide community supervision for people that are out, either under supervision of the court or like probation and parole. So we provide an extra level of supervision. We provide supportive services, counseling. Like I said, we connect them to those services that they need in the community, like substance abuse and mental health, including anger management, parenting classes, family classes, that sorts of things.
We had former police chief Bernard Carrick in as a guest not too long ago, and he was arguing that prison is really a breeding ground for criminality. Have you found that is the case? I mean, is that one of the reasons why you're trying to spearhead alternatives to incarceration?
Of course, I think that's why we're all doing it. We know that prison isn't the only solution in every case. There are alternatives that are viable, that provide somebody a chance to address something that they haven't had the opportunity to address before. A lot of people that come into contact with the criminal justice system don't have access to health care, have untreated mental health issues, or lack access to education or even employment. So what we seek to do is to provide them those services, because prison doesn't really meet all of those needs. You know, there are some jail-based and prison-based services that we provide and that there are available to people in the prison system. However, I mean, as we know, prison houses is a hotbed for violence, for criminal behavior, and in essence, just redirecting the people through the prison pipeline back into the community without the services that they need.
In terms of percentages, I mean, what percentage of the people that you help have mental health issues, and what percentage do the crimes involve substance abuse?
As far as substance abuse, I'd say that's a large percentage of probably all criminal behavior in New York City. I can't speak to exact percentages, but a lot of our coalition members like New York City Task, the Osborne Association, the CASES program, we have substance abuse treatment services that we do provide to individuals that need it. As for mentally ill, I can't speak to a specific range, but it is fairly common, whether it's low level need like depression and anxiety that might account for other behaviors associated with their criminality. I've definitely worked on cases with people suffering from active psychosis, schizophrenia, and bipolar depression.
I noticed on the Osborne Association's website that Mayor DeBlasio and the First Lady visited your association. How supportive has the mayor been of the programs, and what are you really looking from the administration for help with beyond money?
We've been excited and so happy with the support we've just received from the mayor's office. It makes us feel good that we're getting some type of that recognition that community or alternatives in the community are a viable source and part of the city and the state. As for what we're looking for, a partnership and understanding and agreement that we're part of the city's future and progress, and we're looking to support the mayor's office and his initiatives as well.
Joe Chacon, thank you so much for joining us.
Thank you.